Our topic today is self-medication. And what does it mean to talk of self-medication? The implications, the challenges, and what is expected of you. Now, self-medication means when an individual decides the type of drug he or she needs and administer it for whatever purposes. So the crave, the skill, the concept of you going further to pick up medications for what you think is wrong and use it with the intention to get cure or get relief is referred to as self-medication, especially without any expertise directives. What leads to self-medication? What are the factors? Now, factors that account for this as numerous. Among them, number one is lack of education. What I mean by that is that you have been to this wall of schools, but the education we have received is only to read and write. We lack that knowledge, that education to tell you that you don't build your house yourself, you don't sew your clothes yourself, you actually do not repair your car yourself, and in fact, you don't fix your phone yourself. So when you choose to fix your body yourself, what have you done? It just shows that you don't have education, or you are ignorant educated. Number two, an environment of poverty. It's been found that the locality where people lack, where purchasing capacity is low, like what's going on, recession all over the world, and as it affects Nigeria today, this has promoted more of self-medication. Number three, black race, black generations have been found to be fond of self-medication. And this is because we grew up with our local medicine. You are being force-fed with agbo. You are being given some things to drink. So our mothers and fathers grew up with that. And so when you grow up, you have the same tendencies of wanting to find solutions to yourself by using something. But those our parents make use of leaves and bark of trees and things like that. But you go further into English medicine, all in the name of still come from the same concept of self-care as self-medication. Outside this, it's also been found in an environment of social-cultural beliefs. Some of us have gone to a level of believing that those English drugs, those doctors are just taking advantage of us. Let's go to the pharmacy, tell them what we want and tell them what is wrong, and then we'll get our drug. And that's also an evidence of poverty of mind and poverty of the pocket. The pharmacists there can bear with me witness that they are not trained to prescribe, because pharmacists are not trained to make diagnosis of disease. And I challenge anybody to this. And some of us have traveled outside Nigeria. You know what it takes for you to access health? Because it must be monitored. The life of people in the country is valuable to the government. And so we must trace the doctor that saw you, that give you medication, or that prescribed a drug. The pharmacists have right to query prescription, have right to relay with doctors in adjustment of doses, and can also recommend to the doctor on the brands of drugs, or can guide the doctor on the quantity of prescription. So many, but not pharmacies, prescribing to patients like Nigerian does. Because to go to the hospital, It's expensive seeing doctor to register, and then you need to pharmacy without registration, without running tests, without any examination, and then you get treated. That's full of you. Now, what are the risk factors and the problems that can come from this, in quotes, self-medication that a lot of, even you, the CEO of companies, professors, doctors, PhD holders, and master's degree holders, highly educated, celebrities, and everybody, that every one of you are doing on a regular basis. And for those of you that have all succeeded in doing that, you wouldn't have seen anything wrong in that. But you need to sit down and see the problem you have used that to cause, and those that have suffered the setback of these particular practices. It's unfortunate that we still have it increasing more on daily basis than before, because the Nigerian condition is getting worsened in terms of economic value, in terms of ability to actually have what can actually save you with what you have. Among other problems, I'm going to make a list for you. Number one, these practices promote delay of the right diagnosis. So because we're used to self-medication, but you're the one diagnosing and you're the one treating. So it will take a longer time to eventually make a diagnosis of what exactly is wrong with you. Because you are the only one diagnosing, you're the only one treating. And you're not trained to diagnose, but you have access to treatment. So at the end of the day, you have only delayed appropriate diagnosis and appropriate treatment. Number two, you succeed in causing organ damage. Several times, you take out some of these drugs because of what you feel, whereas your feeling has nothing to do with what is the cause. So doctors talk about signs and symptoms. You talk of the symptoms, we look into the signs. So because you have chronic liver disease, an example, organ that's almost going away. One of the effects that you will have low appetite. And what you begin to do is to engage in appetizing drug. And yet the appetite is not coming up. So what will happen? By the time it will be discovered later that you have chronic liver disease, it will be late. Because the same you that think that your appetite that is low is due to maybe you have not eaten some things, you have not eaten some drugs. You go deeper into those drugs and it has not helped you at the end of the day. 5 years later, it was found that you have chronic liver disease. It has not been added value. But because majority get away with it, it appears to be like an added value. It is not. Another problem that this your self-medication does, you cause everybody, is drug resistance. In case you don't know, you will get to understand this very carefully. Let me use malaria as an example. For those of you that are old and listening to me, some years back, we used chloroquine to treat malaria. And gradually, you discover we pack away chloroquine in the circulation and we bring in another drug called artemisinin combined therapy, ACT. What doesn't let you use? You are one of the people that caused it. Because then you have headache and fever. You went to the hospital, right? Yes. You had some tests done, confirm you have malaria. You also prescribe chloroquine that is 4-4-2. Take 4 today, 24 hours later, take another 4. 24 hours later, take the last 2. What usually happen? We took the first 4 today, in the morning. By evening, you're okay. So the next day, you abandon the remaining 4. The next day, you abandon the remaining 2. It's paracetamol, you are done. So you only took 4 out of 10 drugs. Now, what you have just done, and you do that again and again, and not only you, somebody somewhere else is doing the same thing. What you have done is that parasite called Plasmodium falciparum is the name of the parasite that's worrying you as malaria. is a living system. Now, the dose you have supplied to the body is not enough to kill it completely. So what it means that you have been able to kill parts and some. The remaining ones are still alive. They're able to sit down and study the chloroquine very well and identify what is inside chloroquine that is killing them. And they also will now have a meeting, maybe a town hall meeting, and say, now that we know what is inside the chloroquine, what do we do to avoid the chloroquine to kill us? And their scientists will also go into research and say, okay, what we should do now is that let's change our head, or let's change our nose, or let's change our leg, so that when that drug is taken, it cannot affect us as it's supposed to. And that's simple. So gradually, the knowledge begins to increase among the Falciparum malaria to study the way chloroquine works, and eventually the drug cannot kill them. So before it was taken off the market, you give people injection, you give them the tablet, yet they are still down in the hospital. You do the test again, malaria is still there, present. And science realizes that no, we cannot continue this because malaria claims life of more people than Boko Haram kill people. The number of people that die of COVID-19 is small compared to people that die of malaria per year in Nigeria. So the knowledge came in that another drug has to come in to beat the intelligence of the malaria parasite. And that was happened. So you can see how you have contributed to drug resistance. So continue. If only you think you are doing good to humanity, or you are being a wicked or evil to the humanity. The same attitude has gotten to you in antibiotics use. Majority of you are fond of antibiotics. Any small thing, antibiotics. Yeah, amoxicillin. Yeah, it's a bicham. Yeah, it's this one. Yeah, it's a ampiclos. You are well done. Doctor in the house. Unfortunately, most doctors you know don't abuse this antibiotic because antibiotics means, bio means life. Biotics means things that are in a living condition. Anti means against. You can hear anti-robbery, anti-this, antibiotics. Drug against life. So, you have a disease. Assume you have a chest problem, a cough, productive and suspect of pneumonia. But you're not aware it's pneumonia. But to you, antibiotics, wow. The antibiotics you took was ampiclos. And ampiclos will first of all suppress the bacterial pneumoniae that are settled under the lung, under your chest, causing you the fever and the cough that you're going through as pneumonia. The ampiclos will kill you to a certain level. But we doctors know that ampiclos cannot kill bacterial pneumonia to the last level. And so what happened? You got some relief, you feel better, and you move around, thinking that you are done. So the same antibiotics is used again. Within like 2-3 months happen to you, use again. As time goes on, that same antibiotics ampiclos can no more even kill half of what it used to kill initially. So you have causes, what is it, antibiotics resistance. So that's there. Beyond this, some of you have, that's number 5, allergies. You have actually recommended a drug to somebody, and the person took the drug and went blind. You want to confirm this? Go to Pacheli School of the Blind in Surulere. See young girls and boys who are blind on account of anti-malaria, on account of drug given to them by their parents. I met a young lady, she's in the University of Lagos, blind, very pretty lady, and said she was given anti-malaria when she was younger, and she went blind. Somebody can see before. So in case you don't know, self-medication has damaged the life of people. As an allergy, cause a reaction that you don't know what to do, and that person lost part of his life or caused one trouble or the other. Apart from this, number 6, self-medication has succeeded in what is called end organ failure. In recent time, I found somebody, a woman, who in the search for getting a baby got to know that she can Google and find drugs she can use in order to ovulate and get pregnant. Because of a country that is lawless, that life of everybody is useless to the life of the government itself, she went online and can order for that drug injection. Because her husband traveled with the mind that when her husband comes back, they'll just meet and get pregnant. So this drug, any doctor in fertility system cannot give you more than 5 doses. This lady injected herself 28 doses. And the 28 doses now start working. The husband came and she cannot even start to have any sex with her husband because the tummy is now swollen, painful, and now she's restless. The question is now, what have you taken? She was not ready to reveal until doctor asked, if you do not tell us what you have taken, we cannot treat. And she confessed the drug was ordered for online. She injected herself 28 doses to get herself ovulated, to get pregnant, and now she has lost that ovulation forever. She can never get pregnant by normal sex again. So what have you done? She has killed the ovaries by what she has taken. We call it ovarian hyperstimulation syndrome. She caused by herself, by her own hand. So self-medication. Beyond this, self-medication have succeeded to tell us that today, as we speak, the amount of money you spend and wasted before you eventually get treatment is too enormous. You have been treating yourself for typhoid, you call typhoid. You call it whatever you need. And by the time you get to a real doctor, you now start spending money again. What have you done? You have causes waste of funds. And apart from that, another problem is misdiagnosis. Are you aware that one of the things that led to death during coronavirus was that people have fever, they have some other symptoms, and they're taking anti-malaria instead of them to have visited a doctor to discover that it's COVID. Several times, there are many diseases that share similar symptoms. And that's the reason why you must meet a professional that listens to your complaint, that examine you, that eventually run a test before recommending medications that's appropriate. Sometimes you do not need even a drug. You just need water. Sometimes you just need to sleep. Sometimes you just need to eat. Sometimes you just need only ordinary paracetamol. Sometimes you don't even need anything. You just need somebody to talk to you. All of these are provision doctors are supposed to give you. But in your own way, your own intelligence or your foolishness, you went ahead and took medication that leads to all these problems we have identified. Will you rather stop that now and live a good life? Help yourself and help your generation. Stop this practice. It does not add up. For because you've been getting over it, I wait for you till old age and see what happened to you. And if you are told that it's the drug you have been taking that caused it, lo and behold, you have killed yourself. Finally, let me give you this example. A man has been taking drug, and this drug she's been taking is a woman. She's been taking for a while. She doesn't know it kills immunity. And unfortunately for her, she had a skin wound. And they tried to treat this wound for over years. It never heals. And the woman was still taking that same drug that does not allow wound to heal. What do you call that? Self-medication. Now she's suffering of it now. She is now asked to stop that medication. Maybe the wound will not heal. So some drug will not make your wound to heal. Another woman of recent time was having some social challenges, emotional problem, half problem of sleep, and she went taking drug for sleep. She's been taking the drug for years. Now, as I speak with you, she's taking times 10 of the dose of that drug, and she can no more sleep again. She has spent exactly 2 months now. She never closed her eyes because of self-medication. If you get to such level, you're really running mad. In fact, you are mad for you to get to that level of taking medication that eventually get to points not working on you, but rather causing you a side effect. Until I come your way again. Wassalamu alaikum wa rahmatullahi wa barakatuh.